Capstone video. Stacy Tyler, Capella University. Capstone project for nursing. NURS FPX4900. Kimberly Hires, August 30th, 2021. Let me begin by saying that 10 years ago I sought out to attain my BSN degree. Life trickled in and furthering my education trickled out. Over the years, I have reconsidered many times on completing this degree. However, my husband and I did not see eye to eye on pursuing it because the outcome did no more than put a few letters behind my name and rob our family's bank account of thousands of dollars to do so. Or at least that's what he thought. However, over time, the yearning for this accomplishment grew and grew, and in the end, I convinced my husband to let me start the classes with Capella University. My research proved their credibility, and I would be able to work at my own pace. Many of my coworkers discouraged me and would say things such as, "It's a silly degree. It's not worth the money. You will learn absolutely nothing from it, and the gain is just minimal," and so on. Naturally, I wasn't that confident that all the work would be worth the reward. To begin with, I approached my capstone project with absolute exhaustion. To narrow down everything that I had learned in just a few assessments and one final project and then link them all together seemed overwhelming. I could not think of one single subject that would rally my interest enough and then be able to present it with passion as a finale of all my hard work. Initially, I kept coming back to one thing: ADHD in children. That is because one of my daughters has ADHD, and I felt like I could render a decent project with it. Oddly enough, during my meddling, life threw me a curveball. My teenage daughter decided to sneak her boyfriend into her room in the middle of the night and almost got away with it. I will not bore you with the details of that story, but it did spark an idea that would not only fuel my capstone project, but in the end, I can use this project at home as a teaching tool of pregnancy prevention. That is how my capstone topic was born. Contribution of intervention for quality of life. It is not easy to measure the contribution that this prevention plan can make to life, because it essentially affects nearly every aspect of life for everyone. To begin with, we must understand the prevalence of the issue. I found an article about teenage pregnancy that was absolutely startling. This article alone increased my awareness of the issue and elevated my eagerness to help solve it. In the 2017 article by Sohonos, it stated that pregnancy and childbirth are the leading causes of death for teenage women between the ages of 15 and 19. To be honest, I never even realized the high prevalence of it. So after the incident with my daughter, I sprung into action to learn more. To scale down the matter a little, in 2019, Rabidi wrote that teen pregnancy in the United States is one of the top concerns for public health issues. This statement brought it a little closer to home. When I dug in and learned the effects that pregnancy has on teenage girls, I was shocked not only was it affecting these young girls and their children, but also our healthcare system, economy, thus virtually everyone. An article from the Centers for Disease Control and Prevention in 2021 said that teen pregnancy and the resulting children cost the U.S. $9.4 billion a year. Yes, you heard that right, a billion, as in 1,000 million times 9. That is absolutely insane. My research throughout this semester shows that with the right applications, we can nearly eliminate that number. Can you imagine the difference that this alone can contribute to our society? In addition to that, Herman et al. In 2016 stated that it is estimated that 2/3 of teenage mothers endure physical or mental abuse. Another article from 2016, Diaz and Fiel, says that teenage moms are less likely to finish high school or go to college, and therefore have tendencies to experience poverty. If we can eradicate teenage pregnancy, then we can contribute to a better economy and healthier teenagers as well. No parent wants their teenage daughters to experience abuse in any form or start her adult life already with a struggle. Use of evidence and peer-reviewed literature. As I researched for this capstone project, I only sorted through peer-reviewed literature because I've learned that it is the most reliable. Quoted from a 2021 Steer and Ernst article, peer review has a key role in ensuring information that is published in scientific journals is truthful, valid, and accurate as possible. I only looked for reputable sources and searched for other evidence-based studies. Like I already stated, the first few statistics that I found really set the tone for the direction I chose. After understanding that a change in teenage pregnancy prevention needed to be made, I then had to figure out what kind of change such a small person like myself could make. Successful leverage of healthcare technology. Many of the teenagers who do become pregnant lack education or guidance, sometimes beginning at home. Many of them live in poverty and do not have access to good healthcare or technological devices. Stewing on this problem, I found a statistic by Philibin et al. From 2019 that said 95% of Americans live within an area that contains a public service library. Bingo, I thought to myself. Somehow we have to use this to our advantage. Then I found an article from 2020, HRQ Advances New Frontiers in Digital Healthcare, that said the advantages of digital healthcare is that it helps patients to better manage their conditions and coordinate their care with their providers, resulting in better care for the patient. This reminded me of a technology resource that we use within the healthcare system called telehealth. I then came up with the idea that teens can use the telehealth system to communicate privately with their providers on all subject matters, including preventing pregnancy. The profound impact of digital healthcare can play a role in a patient's life that can range from an increase in their quality of living to preventing pregnancy to altogether saving their life. So from there, it was just plugging in the pieces to the puzzle and connecting the dots. Health policy influence. At first, I begrudgingly researched for policy influences, but then I quickly discovered that these would be the brick and mortar of my prevention plan. When I was searching the CDC for policies, I stumbled on a 2021 article about teen birth rates by states and identified that currently the top 10 states in the U.S. for teen pregnancy reflect 25 to 30% of our nation's teenage pregnancies, with most of those having zero sex education at their schools. That did not make any sense to me. How could it be possible that a nation as bright and intelligent as the United States could overlook such a frightening statistic? Is it a coincidence that a quarter of our nation's teenage pregnancies happen in the very same states that do not have sex education? I don't think so. Next, I wondered why. How could it be that not everyone is required to have sex education at their schools? And that is when I found the article in The Role of Policy on Sexual Health Education in Schools that said the United States federal government does not currently mandate sexual education programs in every state or specifics on those programs. There, the answer was in black and white. If we educate all teenagers in all schools, then we will most definitely reduce the rates of teenage pregnancy. My prevention plan will start at the local level, and we will work with this community to make sure that the sex education is a priority. In addition to that, my research exposed a law that was quite startling. A 2018 article in The Independent stated that in Ohio's abortion policy, it is illegal to abort a fetus past 6 weeks gestation. Now, my belief and opinion on abortion does not matter. What matters is that as a nurse, I am able to advocate for my patient and their wishes and what's best for them. Robbins said it best in his 2021 article that said, registered nurses demonstrate advocacy for the patient in all settings, in all roles. The abortion law can affect a great quantity of pregnant teenagers in this state, for the simple fact that a lot of them do not know they're pregnant until they are past 6 weeks. Every state does differ in their gestation timelines, but it is essentially unfortunate for these Ohio teenagers. It is pure irony that the federal law says that you must be 18 to be a legal adult and make your own decisions. But then it takes a few more years to reach the age of 21, where you are now legal to consume alcohol. So it seems we have an understanding as a nation that you aren't fully capable of making wise decisions until the age of 21. The attribution to this is that the frontal lobe in your brain is not fully developed until about then. And that's the part of your brain that helps you rationalize. So therefore, you should not be given choices that may harm you when you cannot fully understand them. However, this abortion law is saying that an underdeveloped teenage mother is wise enough to make a life and death decision, and she must instantly make her decision, or she no longer has the right to do so. So much for sleeping on it. To compound this matter even deeper, my research revealed a stifling fact that performing an abortion past the state's allotted time frame is a punishable offense. The Independent's 2018 article said, not only could that teenager serve prison time, but they can even charge her with the death penalty for having an abortion past 6 weeks gestation. I chose not to include this fact in my final prevention plan because I did not want to focus on abortion laws. I felt like it could be chasing a rabbit down a hole. Anyhow, I did deem it worth noting for this final presentation just to emphasize the weight healthcare policies do have on teenagers. Nevertheless, as nurses, we plow forward and educate these young women about whatever the current abortion law is and encourage them to follow it. Per the prevention plan, we will continuously monitor the laws and abide by them. Although both policies were vitally important to this project, my capstone project was fueled by the federal laws lacking in sexual education in schools. Fortunately, as nurses, we are able to interact with these young teenagers and inform them about ways to prevent teenage pregnancy, whether a law is in place or not. We can do this through the schools, through telehealth at the library, or even through participating in community services with something so simple as posting awareness flyers. Becoming a bachelorette prepared nurse enables me to partake in more productive role. Now, I have the overall standing of how to connect research with everyday health matters and to apply it. Versus before, as an associate's nurse, I just simply would get the nursing job done only. Initial predictions and potential of intervention. I initially entered in this capstone class with utter hesitation. Actually, I didn't even start working on my project for an entire month of being in this course. I hypothesized that I would end up picking an uninteresting project that would bore me, and I would end up poking my eyeballs out by the end. I knew I would learn something, but that wasn't the issue. I just didn't feel like learning anymore. I was tired of all the work and excited to get back to the normalcy of my life. The outcome was drastically different from my prediction. Once I identified my core project, my passion grew with the completion of each assignment. Every time I met with Jennifer Goebel, her own enthusiasm was magnetic. I started with the goal of completing my capstone course and graduating. Instead, I ended up with an inspirational spark to further pursue my research and sprinkle it about my community. As a mother of 4 girls, I now have the understanding of how teenage pregnancy could affect them. Additionally, I have equipped myself with knowledge and tools to actually implement my pregnancy prevention plan. By utilizing the local health care staff, the school staff, and community members, we can essentially annihilate teenage pregnancy in our county. In 2016, Rabite and Enriquez said that sex education is a matter of public health. I cannot agree more, and I'm excited to do my part. Personal and professional growth. Sitting here today, I can assure you that everything I've gone through to earn this degree has been well worth it. I'd be lying if I said at times I didn't doubt myself or want to give up. Honestly, anytime I had a paper due and a family function that would conflict with it, I would consider just throwing in the towel, thinking this is just too much right now. You can do that later in life. However, I would remind myself that I wasn't in it for the money, that I wasn't in it for the title, and that I wasn't in it to impress other people. I decided to do this to demonstrate to myself that higher education is of value. Also, it is a great accomplishment of a feat that I have tried to do for 10 years, and it is well worth the struggle. It was something that I not only had to prove to myself, but also something that I could be proud of. When I finished, I could show my daughters to never give up in adversity, and you're never too old to conquer your dreams. The first RN to BSN class was undoubtedly the hardest. It had been ages since I've been in school, and to re-enter was no easy task. I had mostly forgotten how to write APA papers and truthfully had minimal experience on conducting research. Originally, I felt like some of the topics I was writing about were just fluff work to get me to the end of my BSN. But as each class went by, I realized my insight of understanding nursing capabilities at its core was increasing. I had never analyzed anything to this magnitude. It became interesting to unlock the doors of knowledge as each class progressed. I have been blessed with a family that has supported me along the way, especially my husband. He has even began to pull extra weight within our household in order to help me accomplish my goal. Professionally, I have already been able to apply things that I have learned from different research papers. Not only that, but I have also gained knowledge in some areas that compacted with things that I already knew. With this, it has allowed me to become a better, more efficient nurse. As I enriched my learning from course to course, it has equipped me with a new courage to explore things that I did not understand. Instead of simply going through robotic moves at work, I now ask the question, why? Being more inquisitive has only added to my skill sets. Personally, I have grown in many aspects. I have sharpened my prioritization skills at home and definitely relearned to focus amongst chaos as kids ran about and I plucked away at research. I have gained self-confidence as I set my many goals of writing papers and finishing a class over and over again. I reminded myself that no goal is too big if you break it down into tiny chunks. Most of all, I cannot put a price tag on the most significant outcome that I have obtained from this bachelorette program. I have been re-inspired to dream bigger because I have been reminded that I am gifted and I have the ability to accomplish more. Intervention feedback. Jen Goebel is who I chose to use as my direct care contact and spend my volunteer experience hours with. I was addressing with her the teenage pregnancy and the intense prevalence of it. I chose Miss Goebel to be my contact because she is a family counselor that deals with teenagers and some of them who are pregnant. She sees firsthand the damage that it does to their young lives, and I felt that not only would she be able to provide for me her experience and insight, aside from my literature and research, but she would also appreciate my hard work and the prevention plan that I present. The intervention I decided on was having all the local schools embrace sex education and rally up the local libraries to help students communicate with their healthcare providers, to encourage the nurses to be role models for answering questions through telehealth system, and finally meeting with community members to get everyone on board. The plan is to induce awareness and continue to update laws that may affect these young teens. Also, to have the healthcare system and the schools to continuously provide appropriate sex education to the teenagers. I met with Jennifer Goebel to review Assessment 1 on July 25th for 2.5 hours at a local coffee shop. We discussed the teen pregnancy issue and the fact that there is a vast majority of Americans undereducated in the subject. We further talked about ways the nursing community can become involved to reduce teenage pregnancy through sex education. Assessment 2 was covered on July 21st for 2 hours and 15 minutes with Jennifer Goebel. We again met at the local coffee shop. We discussed teen pregnancy in the context of how it impacts quality of care for the teen and child. We next deliberated on costs to the system and everyone in the society. I identified a state law that possesses a problem with abortion options and impact it causes. We together proposed strategies as to how the issue can be somewhat resolved and be better for everyone. On August 24th, we spoke about Assessment 3. Our topics of conversation took place at the local coffee shop, and we discussed teen pregnancy in the context of how it impacts the quality of care for the teen and child. We then discussed about cost to the system and everyone in the society that was affected by teenage pregnancy. I identified a state law that poses a problem with abortion options and the impact it causes. I also suggested strategies of how the issue can somewhat be resolved and contribute to the betterment of everyone. On August 30th, we met for the last time at the coffee shop. I presented the PowerPoint presentation to her that was covered in Assessment 4. It contained the teenage pregnancy prevention. We discussed the entirety of the project for 3 hours. Ms. Goebel will be able to apply this intervention within her network of associates by sharing awareness and enforcing education for these students. This plan can be used on a daily basis with these teenagers attending class, learning about sex education. Making the community aware will take the help of all members to gather ideas such as posters, media links, radio ads, and such. After presenting the prevention plan to Mrs. Goebel, she was able to immediately initiate it with one of her teenage clients. She shared some of the research with this teenager as a teaching opportunity. She commented on the ease of providing this information to the teenager. The real challenge in utilizing this pregnancy prevention program is gathering up the troops to fight this war. As there are so many problems in our community, it is not effortless to encourage everyone to elevate teenage pregnancy on the list. To have all these schools collaborate together with the appropriate sex education programs is going to be a tough feat in itself. This is not something that can be fixed overnight. It is something that needs to be spotlighted, initiated, and followed through with. Due to the complexity of care coordination and community resources, there are so many different parts of instructions to this plan. Each of these will need to be continuously updated as roles and policies change. Jennifer Goebel believes the plan will be very helpful and make a grand difference in our small town. She believed in the plan so much that she offered to be an advocate for its entry into our community. Ms. Goebel is a member of the city's Junior Civic League. It is a community club that meets together and provides services and collects monies to give back to the community. She said she was going to bring it up to their club's discussion board as a local opportunity for change. This is exciting because there are several neighborhood leaders amongst the group who have connections to many people in this town that can rally to make a difference. She said that if our leaders welcome this new awareness, then we can make a large positive effect on our society. The effect can be measured by recording today's statistical data related to our local teenage pregnancies every 3 months. From there, it can be reevaluated and compared to the previous numbers and numbers in the past. Surveys can be given to the students to gain insight of whether or not they grasp the content and its necessity. I am blessed to have met Jennifer, and I'm honored to be able to share this experience with her. I believe that our partnership is going to make a dramatic positive shift in our community. and positively influenced several teenagers. What began as only a goal of graduating has now blossomed into something with the potential to change lives. I am happy with my outcomes and abundantly proud. Thank you for your time.